Okay, well, welcome to 5 patient-centric ways to improve your self-pay. To improve your self-pay revenue. I am Denise Tobin. Good morning, everyone. I am here with I'm here with people from HBCS, my company, along with Health First, which is a health system on the Space Coast in Florida. And I'd like to introduce our speakers today. So first we have Bonnie Causey from Health First. Bonnie Causey is Director of Revenue Operations, Patient Accounting for Health First. She is responsible for all aspects of the financial journey after the initial admission through collections process, whether it be insurance collections, self-pay collections, or bad debt review and placement. Bonnie started her career in the healthcare industry in 1988, and over the last 30 years, she has held positions in all areas of the revenue cycle management. Thank you, Bonnie, for coming today. We appreciate you. And then from HBCS, we have Stephen Wing. Stephen plays a pivotal role in developing tech-enabled solutions to drive the highest return on investment for HBCS's clients as Vice President of Operations. Since rejoining HBCS in 2014, Steve has been responsible for leading the development of solutions that deliver an exceptional patient experience, optimize collections, and enhance accounts receivable management. He earned his bachelor's degree in international business from Goldie Beacom College in Wilmington, Delaware. He's an active member in HFMA, AHAM, and other professional organizations. Thanks, Steve, for joining us. And along with Steve, we also have John Rogers. John Rogers is Assistant Vice President of Self-Pay Operations at HBCS, where he leads client engagement and patient account resolution teams on behalf of health systems throughout the U.S. He has over 15 years of experience in hospital revenue cycle and customer service operation. John holds a bachelor's degree in political science from Pennsylvania State University and a certificate in project management from Villanova University. Thank you all so much for joining us. We appreciate you all being here today. And I am Denise Tobin, and also from HBCS, we have Bill Rogers here as well. And as you all probably know, Bill, this is our home chapter, Georgia, so we're really excited to present for you today. So I'll let the team take it away. Thank you.
Thank you, Denise. Good morning, everyone. Glad to present to you this morning. Wish we could be there in person, but definitely the next go round. Just a little brief synopsis of HBCS. We're excited about the opportunity to present, obviously to the Georgia, chapter. Just a brief overview. We provide services and have provided services for over 35 years. Exclusively in the healthcare industry. We have focused over those years, really a targeted and focused approach around, 3, primary service, verticals. Newer one is the virtual patient registration, but our 2 longstanding service delivery operations have been around insurance follow-up and reimbursement, and the self-pay / early out customer service and patient resolution. We do operate 3 brick and mortar operations or CBOs across the country. We have over 500 revenue cycle professionals. Prior to the pandemic, we were operating with approximately 33 to 37% of our workforce working remotely, and along with just about everyone, we did move to a 100% virtual environment, and we continue to do so at this juncture as we navigate through the space as far as bringing some of our revenue cycle professionals back into the office in some type of hybrid or rotational capacity. We focus a lot on technology and analytics, and we continue to make a lot of investments, not only in the technology and on the analytics, but also in our talent management, which we'll touch on throughout our presentation, today. Overall, we're processing over 5 million accounts, annually, $5 billion in charges, and we are getting reimbursements of north of $3 billion in reimbursements. So that's a little bit about organization, but more importantly, we established a partnership, a really strong partnership with Health First, working with Bonnie and Sean Ronan and that team, working towards a mutual collaboration, incorporating thought leadership and really working to identify, solutions to really attack and resolve some of the issues that were being experienced. We were excited to work with the leaders at Health First. We did provide a comprehensive and continue to provide a comprehensive customer service resolution, operation, and solution. Throughout this process, we focused with Health First on a couple, key areas. A couple of the key areas were on the digital patient communications, propensity to pay, insurance eligibility, scoring. At the time, these were areas that had some significant opportunity, and through those results and through the technology that we were able to deliver, we were able to drive a 35% increase in self-pay collections, reducing the self-pay volume or inventory by 12%, processing over $6 million in self-service transactions between IVR and the patient portal, which was newer to Health First at the time. And we also used our insurance eligibility processes to identify over $1 million in insurance eligible claims really early on, the first 90 days of the partnership. And then we continued to see those advancements and some of those results throughout the partnership. One of the key linchpins of the partnership has been really our focus on the patient experience, the patient satisfaction, and ensuring that reducing and minimizing patient issues, patient complaints throughout the life cycle of working the self-pay and early out. So next, what I'll do is turn this over to Bonnie, and Bonnie will give you a brief synopsis about Health First.
Thanks, Steve. Good morning, everybody. I'm Bonnie Causey, Director of Revenue Operations, Patient Accounting for Health First. Before we jump into our presentation, let me tell you a little bit about Health First. Health First is a private, not-for-profit integrated delivery network located in Brevard County, as Denise said. We're located on the east coast of Florida, about 45 minutes east of Orlando, and we're the home to Kennedy Space Center, Cape Canaveral Air Force Base, and Port Canaveral. Brevard County celebrates space innovation and exploration, and we're also the world's second busiest cruise port. Our hospitals serve not only the local community, but we also serve the tourist population, which can be a little bit challenging at times. As an integrated delivery network, we're able to deliver patient care to patients in the community at all levels of the healthcare continuum. We have 4 acute care facilities with 868 beds, a pediatric ER with a level 2 NICU, a physicians group of over 400 physicians, a health plan, and an outpatient wellness division. We've got about 9,000 associates, and all of those associates are committed to putting our patients first. So this fits right into our model. So let's dive into the self-pay revenue collections. Today, we'll be looking at some of the challenges of self-pay revenue collections and the steps that Health First has taken to ensure we're putting our patients first in those collection conversations. Our overall challenge is to understand how we can engage with our patients in a more patient-centric manner so that we can elevate that patient experience. If we do that, we really need to remember that more than ever, the clinical experiences are not the only experiences that matter to our patients. The financial experience matters as well. If we start by listening to our patients and their overall situation and consider their needs in our decision-making process, we're likely to find that patients are more willing to become part of the solution, which ultimately will contribute to the success of self-pay revenue collections for the organization. At Health First, we identified 5 areas of opportunity to ensure we were pivoting toward that patient-centric operations we wanted so badly. First, we realized that as good as our patient access team is, we needed to strengthen some of the processes surrounding that to meet our patients' needs in our new environment as it is today. We determined we needed to leverage all the available screening and propensity to pay scoring tools and workflows that were available to us. We had to improve our patient communications and update digital experiences that we offered to our patient. We had to identify collaborative outpatient outsourcing options. And we needed to optimize our workflows for charity care and customized financial assistance protocols. So let's look at some of those challenges and how we address them at Health First. Our goal at Health First was meet the patient where they are. And you might be thinking to yourself, well, that's clever wording, but what does it really look like? Because that's hard to figure out. So meeting the patient where they are to us meant providing solutions to our patients that were specific to their situations, their needs, and being empathetic to their priorities. Ultimately helps us align our tools to deliver a financial experience to our patient that sets us all up for success. So how do we offer options that are patient-centric? How do we meet the needs of patients where they are and remain successful in what we need to do in our collections? Does the patient journey, or does the patient want a contact-free option for all aspects of their financial journey? Do we give the patient the ability to control his or own financial experience? All of those things are things that we considered. So let's start at the beginning of the patient experience, because we need to recognize now more than ever that healthcare is shoppable. With that said, we need to make sure that the patient's experience is transparent and provides the patient with as much information as possible to avoid shock and surprise when they get their hospital bills. At Health First, we worked very hard to remove that surprise. We believe in offering transparency to our patients prior to services when we can, by starting the financial conversations early in the account life cycle. The key to those conversations is really to listen to your patients and understand their struggles. With that information, we develop options for them that meet their needs. We looked at our use of propensity to pay information before the conversation, where we were able to, and use that information to guide the discussions. And lastly, for all of us, COVID has changed the landscape of not only our lives, but also the business end of what we do. We're dealing with patients who are juggling multiple priorities now, including job changes, job losses, childcare issues, homeschooling, and long-term health concerns. Resources are changing every day and patience is wearing thin. People are still confused and frustrated with the misinformation that's out there about testing and treatment and how that relates to the patient responsibility and what they're required to pay. So let's look at how we tackled those. First, we worked to enhance our patient registration process. For our scheduled patients, we provide options to those patients that allow them to complete their registration in a no-contact environment. This allows patients the flexibility to complete all the necessary registration tasks on their own schedule in the comfort of their own home. Not only can they complete information necessary, but they're also able to provide their IDs, their insurance cards, and signatures via a link that we push to their phone. We delivered a cost estimate and options to pay their patient responsibility in the same contactless environment. So they have a complete picture of their upcoming service before they set foot in one of our facilities. Registrars are still available if the patient opts out of the contactless experience or if the patient has any questions. We utilize available software solutions to verify identity and insurance information prior to the patient's arrival and make corrections as necessary when we need to. Working by exception to address the errors helps us meet service deliverables and maintain key performance indicators within our organization. To ensure we're working on continuous improvement, we have a robust QA process and real-time feedback to our patient access teams for immediate review and correction of information which results in clean claims out the door. For our patients that present to the emergency room, we also provide that same contactless opportunity at the appropriate time during the visit. Obviously, we adhere to the MTALA guidelines, but at the right time, we push a link to the patient's phone or the designee's phone to complete the registration if they're able. If they don't have a smartphone, we provide them with an iPad for them to use. The patient and or their designee can complete the registration to include the same things, the scanning of the insurance cards, the ID, and the signature forms. We provide a service estimate based on the most frequently charged ED level fee and provide the patient with a payment option should they decide they want to pay. We provide full transparency and strive to ensure that there are no surprises. As with scheduled patient, registration staff is always available if the patient or their family has questions or prefers not to register electronically. For our inpatient population, we have a highly trained team of financial counselors. Their goal is to speak to each patient prior to discharge about all aspects of their account. To prep for those conversations, the team verifies all insurance coverage and benefits, full propensity to pay information to gain insight into the patient's financial picture. With that information they have gathered, they sit down with the patient, review the information, and find the right solution with the patient's interests in mind. The hope is transparency early in the interaction can lead to an informed and pleasant patient experience. If the financial counselors are unable to collect patient responsibility at the time of service, our goal is to set the patient up for success in the next level of the workflow. We encourage our patients to use financial counselors as their lifeline once they get home, should they have any questions related to the bill or the next steps in the process. So John, can you give us some insight on how HBCS leverages screening and propensity to pay workflows?
Sure, thanks Bonnie. I'm John Rogers, AVP of Self-Pay Operations at HBCS, and I've had the pleasure of working closely with Bonnie and the Health First team, as has my team, over the course of our partnership. And picking up on Bonnie's overview of patient financial engagement on the front end, it's important that these excellent strategies and tools that are deployed by patient access are complemented by financial clearance analytics and intelligent workflows throughout the self-pay cycle. So what begins on the front end needs to be supported and enhanced through technology and intelligent workflow throughout the 120-day cycle of early out. So a successful outsourced partnership will round out these internal processes with integrated technology and expertise that might be cost prohibitive and challenging to coordinate internally. So for example, all accounts placed for collection of patient responsibility should not only be scrubbed for demographic errors and updates, but also evaluated for presumptive charity, so as to ensure continuity of care, maximize the health system's community benefit, and of course, ultimately reduce bad debt. So as we're looking at here, an automated presumptive workflow leverages analytics to make the adjudication timely, accurate, and seamless for both the health system and the patient by integrating that propensity engine with the PAS system to make sure that that data is flowing in a timely manner and the workflows are driven accordingly. So a flexible solution also includes a propensity to pay engine that not only scores and segments guarantor accounts, but then also dynamically drives the patient engagement strategy within your digital communications and contact center platform. So gone are the days of sort of applying a static score to buckets of AR and dialing accordingly. Really, it needs to be a much more dynamic and automated workflow where not only the timing of those outbound and outreach efforts is driven by that workflow, but then also the content of those conversations and the strategy that your patient engagement professionals are deploying to have those financial conversations with patients. So the goal is to make sure you're having the right financial conversation with the right patient at the right time. And that's how you maximize your payments and patient satisfaction and ultimately reduce your cost to collect, by hopefully precluding unnecessary paper statements and getting to that patient when they're most likely to pay. And so to this end, it's important to proactively offer your patients tailored payment plans, not just tiered based on balance, but also based on propensity, ability, et cetera, and also induce enrollment in auto pay across all of your channels or auto debit in order to unlock those revenues within both the after insurance and true self-pay AR. And auto debit is a surprisingly underutilized feature in healthcare payment arrangements. But the obvious benefit of that is convenience for the patient and also a much lower default rate on what is essentially a 0% financing arrangement. And then lastly, your solution should bridge the gaps in the existing internal processes by identifying and billing any missed coverage, confirming bankruptcies and estates, and flowing these updates back to the patient accounting system. And that sort of integration is really where HBCS really shines. And we take the time up front to make sure those workflows are integrated between our system, our platform, and the hospital's PAS in order to automate as much of that as possible and really give the patient financial team a lift. So moving now to the sort of digital wedge or digital layers. A comprehensive financial clearance protocol also demands a robust patient communications platform, and that needs to meet patients where they are, offering the opportunity to engage with your brand, in this case, Health First, through the channel that they find most comfortable and convenient. And earlier, Bonnie mentioned that healthcare is increasingly shoppable. And keeping that in mind, it's important that the solutions we offer patients for self-pay, the manner in which we engage with patients, is comparable or better to the solutions they have out in the marketplace for their retail transactions, their shopping experiences, et cetera. There's a certain sort of intuition and a certain sort of template the patients expect to have in their user experience. And if you're not providing that to them, it's a competitive disadvantage. So shoppable, yes, and that's why it's important that the technology rises to the level of real consumerism. Increasingly, that means digital options like secure text messaging. So healthcare has been slower than other sectors to adopt what is now a ubiquitous technology, secure text messaging. And that's mainly due to sort of the singular compliance concerns of healthcare, TCPA, FDCPA, HIPAA, et cetera. But there has been recent regulatory guidance around patient communications. Front-end operations have, for the most part, improved their consent protocols and their opt-out protocols. And then the technology itself has become increasingly user-friendly. And so these things combined have led to a threefold increase in the adoption of text messaging in healthcare, specifically since 2016, which is pretty dramatic. And that's for good reason. Studies show that upwards of 90% of consumers are willing to receive text messages from businesses, and that those born after 1980 check their phones an astonishingly high number of times per day, 150 times per day. So that's a huge opportunity to engage with patients. And while demographically, there may be patients that gravitate more towards traditional methods of communication, such as paper statements, you cannot forego that digital solution. It's just a huge opportunity cost. So your text solution is really the tip of a digital wedge that includes e-statements, a branded or white labeled portal with responsive design, such as we provide at Health First, and then an interactive voice response system. And then going one step further with that white labeled portal solution, a single sign-on or SSO solution, such as we're currently implementing at Health First, can make navigation of the integrated platform even more frictionless and intuitive for patients, as familiar as their experience on other consumer sites. So just for example, if you are on Health First's public website and you click on the patient section and you click on pay my bill, and you go out to the HBCS's white labeled portal, you no longer have to sign in again. It is all put through a brand filter, so it's a seamless visual experience in terms of the touch and feel of the portal, but also through API, Health First is able to pass the credentials through to HBCS for validation on the back end, and that patient is plugged right into the payment options. So that's a solution we're deploying right now, and it's increasingly sort of the best practice when you have sort of a balkanized digital platform across multiple hospitals. So on the back end then, we offer payment gateways connected by API to your merchant accounts with associated remit and reconciliation processes that support automated cash posting with fewer errors and manual interventions. So a great patient experience on the front end, then on the back end, tight financial controls, automated cash posting, the provision of 835 type remit files, really giving PFS and cash posting and treasury a big lift in terms of human resources and manual interventions. So we've actually seen the success of this approach in our experience at Health First, and Steve shared some of the highlights of our engagement. But since deploying these digital solutions, we've actually seen a 38% increase in the utilization of our patient portal. And this in turn has led to a 69% increase in payments through mobile or tablet devices. And so we have the analytics to obviously see what sort of devices people are using when they engage with our digital solution. And the convenience of digital platforms becomes clear when you see the times of day when patients are making payment. So on our own platform, a full 33% of payments come in after hours between 6 p.m. and 6 a.m. So if you build it, they'll definitely come. And whether your patients are old school and still prefer writing a check to a lockbox, using a remit coupon from a mailed statement, or clicking through a secure text message, meeting patients where they are, as Bonnie said, means giving them the exact solution they find most convenient and comfortable in order to drive revenue and patient satisfaction, ultimately brand value for your health system. So with all this digital talk, let's not lose sight of the importance of an effective paper statement. At the end of the day, the vast majority of your patients will still get at least a detail bill in their mailbox. And it's important that your statement design complements your other communications channels in terms of feature functionality, brand aesthetics, et cetera. And whether that means driving digital engagement, educating patients on the digital channels, whether it's a MyChart or what have you, and inducing hopefully their use of those self-service options, or it could be just driving checks to your lockbox. But that paper statement is still a very important tool, and the design really needs to be up to date and up to standard for that new consumer world in healthcare. So on that note, back to you, Bonnie.
Thanks, John.
Yep.
This one is the enhancing of the patient financial communications was a tough one for me, because for me, it all seems so easy. I mean, I deal with it every day. So I look at it and I understand it. But I have to understand that not everybody sees it the same way I do. So what we had to do is we had to step back and get outside of our own head on it. I started thinking and realized that within my own family, I'm the person everybody comes to when they get a hospital bill and an explanation of benefit that's confusing them and it doesn't make sense. So I had to finally admit that most patients don't really understand what they're being billed for. So if they get a complicated billing statement, it only serves to frustrate them further. First, we tackled the statement challenge by taking things back to basics. We redesigned the layout of our statements to be more aesthetically pleasing for the patient. We customized verbiage based on where the account was in the workflow and worked with HBCS to ensure that our statements supported patient understanding and common use terms. We improved the design that, like John said, guided the patient to the payment portals that were easy to access from any platform that they were using. We provided clear information on statements on our payment options and our resources that patients could tap into in order to get assistance with resolving a bill, as well as the options for contacting the office should they need any further assistance. And as John said, we still offer the old school options of mailing in a check if that's what the patient wants. We're currently working to combine our physician statements onto our hospital statements and presenting a consolidated bill to the patient. So that's coming up. So streamlining processes. In recent years, we've all seen a rise in the self-pay population as well as the underinsured. To help us with this, we encouraged our teams to work one-on-one with our patients to understand their specific situations. We utilize all tools available prior to speaking to the patient to determine presumptive scoring and to find protocols that work best for our patients. Doing all this upfront prepares our teams for the conversations. It's easy to sit down with a patient when we have half the story, we know where they're coming from. We engaged with HBCS to better understand and design our customized workflows at the partner level and enhance conversations with the patient. Once we have the account and the appropriate workflow, we consider all outstanding balances for that specific patient and use that as leverage to make a connection with our patient. We encourage patients to partner with us to find solutions that are acceptable and leave them with a positive financial experience, which translates to increased satisfaction. Another item that I believe is key is follow through. Patients need to know that they're more than the voice on the other end of the phone or more than a few dollar signs to us. We emphasize that by making sure we meet any deliverable that we commit to during that patient interaction. Offering the most appropriate solution to the patient will result in better outcomes for all involved and lets the patient know that we're interested in the entire patient picture. So on to identifying effective outsourcing options. To be successful, we also realized that we had to identify effective collaborating outsourcing options. An instrumental part of meeting our patient where they are was ensuring that we had selected an outsourcing partner who was the right fit for our patients. The partner we selected had to be willing to take time to get to know our patient base and what their needs were. Selecting partners with the patient in mind results in increased collections, increased patient satisfaction, and success for the organization. The right partner had to be willing to listen and collaborate with our patients as well as our organization, present solutions that were flexible, balanced, and sensible. They had to develop programs and protocols that fit the organization objective to ensure we meet our patients where they were. The workflows must allow for discussions early in the process so that educated decisions can be made on how to handle accounts and what the best protocols are. And lastly, we needed a partner that was willing to proactively identify the right tools for the patient to facilitate easy resolution of the outstanding balance, regardless of whether it was approved payment plan methodology, patient financing, state eligibility assistance, and financial assistance. The ultimate goal is to have a partnership that's a win-win-win for all, the patient, the outsourcing partner, and the organization. Let's turn it over to Steve to talk about measuring the patient experience.
Okay, thanks, Bonnie. So far, Bonnie and John really dive into some of the automation, some of the workflow, some of the technology that's utilized, upfront during patient access, but really throughout the life cycle of an account. That whether it's statements, digital, portals, scrubbing techniques, and so forth. So I'd like to just spend a few moments on when we talk about the patient experience. What does that really mean? We think about patient surveys, which we do deploy, for Health First and many of our, or really all of our hospitals and clients. But we really look at additional ways to measure the patient experience by understanding what patients are saying, not only through the phone conversations, but also what team members are saying. We've talked a lot about customer service. We're providing a customer service solution and ensuring that not only understanding what the patients are saying, but what team members are saying and providing is really important and critical to ensuring an overall helpful and quality patient experience. So we're going to touch on a couple of areas: workforce management and technology, the communications and engagement, a quality aspect of the program, and then some productivity and measurement throughout the conversation. So when we talk about workforce management and technology, there's technology drives our processes. There's no other two ways to say it. We need to rely on technology. We need to rely on automation. We need to rely on our processes. But then how do we incorporate that into our program in order to ensure that we identify true, patient patient follow-up success. So we're focusing on a consistent, improvement, of our team members, and we'll touch on training, but really gets down into workforce management. So, what workforce management? By definition, workforce management is a process that maximizes performance levels and competency within the organization. We want to make sure that we're creating not only just a positive atmosphere, but also ensuring that communication lines are open. We set attainable goals, for team members. We have maintaining a good company culture from not only HBCS in this case, but also the company culture, more importantly, of the hospital. Because, we are oftentimes, we say, we're the voice of each hospital's organization as we're providing, these solutions, throughout the various patient communities, and also utilizing, software and technology solutions in order to provide that. So, workforce management is also tied into, contact center, tools as far as, skills-based call routing, that helps to deliver the right call to the right person at the right time to handle, that account. Measuring, real-time, performance statistics as far as all the inbound and outbound, call traffic, that takes place. So we have a workforce management team that handles that, and that is also is incorporated into various scheduled adherence, call avoidance, real-time tracking. Being able to measure all of these areas gives us all the opportunities to ensure a smoother delivery of the services that we're providing, to the hospital. Technology-wise, we have all the calls are recorded for quality assurance, along with screen capture. Screen capture is I'll touch on that too. Screen capture is really important from a quality measurement standpoint, so we ensure that team members are utilizing the right tools that are provided to them as far as policy, procedures, and different ways of handling various accounts. Performance tracking, not just tracking how many calls that team members are taking. That's the easy part. But really, tracking as far as making sure that we're adding notes to the account. And I know some of this sounds a little bit kind of in the weeds, but as far as ensuring that, team members are available, team members are ready to answer and patient questions, especially in a continued virtual and remote environment. These are all areas that are critical, not only to have the technology deployed, but being able to ensure that this technology and these solutions are able to be accessed at the desktop, virtually, wherever any representatives, any specialists, may exist. And that's one thing that we have that we've worked on and deliver, throughout, the solutions and the services. Go into quality conversation a little bit here. From a quality standpoint, ensuring that we have a real-time quality assurance program, monitoring for continuous improvement. So we have mainly 4 areas that we really focus on throughout the quality continuum. Goals, identifying goals, and ensuring that team members are aware of what those goals are. So we provide not only the goals, but the real-time coaching, for those team members, identifying the accounts in a timely manner, and having the ability to be able to fine-tune some of the areas. We do utilize some of the technology around the workforce management, which is also provides an integrated, QA, tool. It's not 100% automated. There is a quality assurance team and unit that is there to augment not only the coaching and the feedback, but to ensure that we go through some fine-tuning on a consistent basis to ensure what we're measuring is appropriate. So that continuous review and improvement is critical. Identifying what the outcomes are, providing transparency, to the team members, That transparency is, we deliver that through a quality assurance scorecard. And I'll share a high-level example of what a quality assurance scorecard, would mean. And it's public. We share that with all of our team members, and that's to ensure that we have that critical insight, through all of our team members, whether it's management team, the hospital. These are results and information that we do share and collaborate, with our hospitals to ensure that they have all this information that we have. So we just don't keep this information, close to the vest and to ourselves. Mention our key players, which is our independent, QA team, but this also includes operations management and the hospital. So what I'd like to do is just touch on an example of a quality assurance scorecard. Again, this is high level. We focus on 4 main areas of a QA scorecard: process and compliance, ensuring that we're identifying who we're speaking with. It may sound like a little bit of a detail that often is not focused on, but it is critical, especially when we do have third parties that are calling in on behalf of patients. We need to make sure that we go through that authorization, documentation, and then identifying, making sure that we are prepared in the opening of the call, the closing of the call, the thank yous, calling patients or guarantors by their first or last name, however they, would like to be, called. The research, on the account. And this is, 20% of our tools. So the first, process and compliance, is 25%. Research is 20%, making sure that they're utilizing all of those tools. This research component is where the screen capture really is helpful, so that we can monitor the tools that are used in order to effectively identify the solution and the answer, for that patient. Resolution on the account, providing what we have identified through our research, providing that information in a clear and concise manner back to the patient. We all utilize industry vernacular that we are all familiar with, but the patients aren't. So we need to kind of run that through our own filter while representatives are on the phone and specialists are on the phone to provide that information in a clear manner. And then overall customer service experience. So we utilize this quality assurance scorecard for our insurance department and our self-pay customer service. It is based on a leverage to use an incentive, based on an incentive program on a monthly basis. And although we're talking about ways to improve the self-pay revenue from a call standpoint, from a customer service standpoint, we have worked with Health First in improving the overall patient satisfaction. And really the focus that we believe is on the quality aspect of it, to make sure that, we are answering the patient's questions, identifying what their true question is, helping them navigate, throughout receiving that patient-friendly bill. But we all know it still can be confusing, especially when, trying to attach that to an explanation of benefits. And for patients that may, unfortunately, may be experiencing a multitude of healthcare situations that bring in a lot of bills that it can, in some cases, inundate them and cause a lot of stress. So we look to minimize that and answer, these questions in a very clear and concise fashion. So quality is our number one goal in delivering the overall, customer service experience, to the patients. From a productivity standpoint, mentioned, yes, we are handling a lot, over 70,000 phone calls, but our team members, we don't incentivize and measure them based on how many calls that they're answering. We do incentivize them based on the quality. We do incentivize them based on there is a collections component, and ensuring that they are available and they're utilizing all of those tools. And what we have found is that the combination of quality and ensuring that we're delivering that patient experience, that is going to drive, and it has proven to us to drive, increased, patient revenue versus just simply focusing on how much you're going to pay, when are you going to pay. Sure, that's part of the call, but that's not the only, that is not the key focus, on the, when we're working with your patients. So that's a little bit about, quality and productivity and so forth. I'll turn it back over to Bonnie so that she can take us home and talk about the additional ways to improve patient revenue.
Thanks, Steve. So let's look at the takeaways from today's presentation. The 5 patient-centric ways to improve self-pay revenue we've identified are strengthening the patient access process to start the patient responsibility conversations early in the life cycle of the account, leverage screening and propensity to pay scoring and workflows to advance accounts towards the right solution for the patient, enhance the digital experience for the patient to allow for patient-friendly communications and positively impact the patient experience, identify partners that are collaborative and flexible and interested in not only your organization's needs, but also meeting the patient where they are, and optimize workflows for financial assistance and or charity care in order to ensure you know early in the life of the account the best option for the patient. So thanks for spending time with us today. We're wrapping it up, and let's open it up for any questions you guys may have.
All right. Well, good. There's no questions because we're running late. So thanks, guys, so much. And if you do have any other questions, though, please come up and see either myself or Bill Rogers, and we'll relay them back to the team. But I really wanted to thank Bonnie and Steve and John. Thank you so much for everything. I'm sorry we ran a little short on time, but thank you all so much for coming remotely. It was nice.
Thank you.
Nice to see you on the screen. Thank you.
Bye-bye.
Bye.